Capital General. Now, we would like to look at actually some specific nutritional considerations. Again, I will be a little bit faster in this because you have the handouts. So if we have SIRS or multi-organ dysfunction syndrome or your MODS, no? MODS. So usually these are the characteristics, no? Grabe ang caloric requirements, hyperglycemic, no? Grabe ang catabolism. So what will you do? So these are your clinical maneuvers. Maybe you can increase the total caloric requirement by 10 to 20%. Of course, insulin to manage hyperglycemia. You try to prevent nitrogen catabolism, no? And of course, you try to maintain electrolytes to normal levels. The renal nutritional considerations will be discussed by Dr. Lasso further tomorrow. So just remember that you can the renal failure patients are intolerant to fluids. That is why you should be very careful and you should ask permission from your nephro, no, whether you can do this or you can do that. Okay? Or else simag-simagan with that. Sige. Or, I will not go further into details on this, no? Okay. Because Dr. Lasso will be elaborating it further tomorrow. Liver failure, no? What is the problem with liver failure? The proteins. So you try to maintain the protein at around 1 to 1.2 grams per kilogram. Of course, if you have ascites, you try to visit fluids. Okay? That is why you have to ask permission from your gastro who manage your case, whether he or she will agree on what they wanted to eat, particularly for patients who are really markedly having liver problems. Okay. Now, this is it when it comes to pulmo. Actually, sa pulmo, hindi kaya kong mag-research because most of the preparations are what? Calorie to nitrogen ratio actually is already good. No? It's already a premix. It's been there. No? Unless you overfed it. Mula dahil makita na dahil ano naman ako masultigit ako ginagmay lang sa. No? Because I have seen already what will happen to my patients, particularly those who have patients into pulmonary edema, congestion, or even ARDS or non-ARDS patients who actually went into demands. Okay. Sometimes, if I have difficulty in weaning, I try to assess what is happening to my patient. Kulang siguro niya sa muscle mass, kulang siguro niya sa kusog gamay. So I try to look at it. Okay, and maybe increase further the nutritional feeding to a particular pulmo patient. Okay, so usually kasi their oxygen consumption is increased by 15 to 20%. Okay, but this is just good in here. It is less than at bedside. Okay. Obesity, ano yung problem? Tampo kayong pasyente pero dehydrated. Yung saon mo siya. The rule is, the rule is, you should compute using the ideal body weight for that. Kaya may mga pasyente nga inana, dako kayo sa pero, ugan, kayo siya. Diba, birahan na yung siya. Di kakabalo kung hydrated siya. Sinakuha na siya daan eh. Diba? Problem. Actually, very problematic ang this. Okay. Pre-existing malnutrition here. Poor nutrition asa. And again, be aware of the refeeding syndromes and fluid and salt retentions, including erythema. Mali actually kahit ako matay sila kung sobrahan yung kalit-kalit. Okay? Diabetes, ang Dr. Chang na siya, gawin na natin nahilapkan. For AIDS, bone marrow transplant, okay? Surgery, trauma, and sepsis, I think, has been elaborated by Arlene. Usually, these things actually are still controversial. We will see later on. I will show you the evidence. Okay. Geriatrics, close monitoring is very important. Now, currently, there has been a lot of studies when it comes to supplemental nutrients. No? So, what are the role of these new compounds, including immune nutrition? Because these are the things that will sell. The other companies will tell you about compounds present in their feedings and the immune nutrition. So these are actually the immune nutrients. No? These are conditional actually immune nutrients that is being studied nowadays. So glutamine, arginine, omega-3, antioxidants, glycine, and nucleotides. So the basis actually, particularly for glutamine, is its effects on specific metabolic functions. Okay, so it can actually promote ammonia and hydrogen ion excretion, immune response during pyrimidine synthesis, glutathione synthesis, and may mobilize. Actually, these are mobilized from skeletal muscles during catabolic states. This is a meta-analysis done, by Novak, telling us that giving high doses of glutamine in critically ill patients may improve outcome in patients post-operatively and those who are critically ill. Okay? So far this